and welcome to Askimo TV. I'm talking today to Dr. Jen Nash. Dr. Nash, the London-based clinical psychologist living with diabetes, who specializes in the emotional support of people with type 1 and type 2 diabetes at Positive Diabetes. Hi, Dr. Nash. How are you?
Hi, Joanne. I'm very well, thank you. It's great to chat to you today.
Lovely to be talking to you too. Let's talk today about diabetes. So I guess let's start with, what is diabetes?
Well, diabetes is a condition in which the body fails to produce or properly respond to a hormone called insulin. And insulin is needed to unlock the energy from our food and unlock the glucose from our food and turn it into energy that we can use in our day-to-day lives. And there's two different types of diabetes, type 1 diabetes and type 2 diabetes.
What are some of the signs and symptoms of the two various types of diabetes?
Well, type 1 diabetes is the condition in which the body fails to produce any insulin at all. And it's an autoimmune condition, and that means that our bodies don't realise that we need the insulin to function in our body, and our body's immune system attacks it as if it's a germ or a virus. And the signs and symptoms of type 1 diabetes are increased urination, so going to the toilet more often, and this is because our bodies want to get rid of the glucose that it can't use, and it does this through flushing it through our urine. And associated with this, another symptom is increased thirst, because we're going to the toilet more often, we're getting very dehydrated, and our bodies want to rehydrate our cells, so we have a motivation to drink much more water. Another symptom of type 1 is increased hunger, because our bodies aren't using the glucose in our food. Although we're eating the same amount, our bodies are malnourished, so we get more hungry and we've got a bigger desire to eat. And linked to this, weight loss. So because our bodies can't use the glucose through food, our bodies turn to our muscles and fat stores, and we burn those much more quickly in order to get an alternative source of energy. Type 2 diabetes is a bit different. The body is producing some insulin, but the body is resistant to the use of insulin, so we need more and more to be able to convert the glucose from our food into energy. Two similar symptoms to type 1, increased urination and increased thirst, for the same reasons. But with type 2 diabetes, there are other more physical symptoms. So many people report blurred vision, because our eyes don't know quite what to do with the changes in blood glucose levels, and so we get blurry vision. Often there can be numbness and pain in the feet and legs, and this is because the body, there can be nerve damage associated with type 2, and so there can be some loss of feeling there. Also, obesity is a big factor in type 2 diabetes. People are more likely to be overweight, and that's because the body needs to work harder to convert that glucose into energy.
How is diabetes diagnosed and treated?
Well, both types of diabetes are diagnosed very simply through a blood glucose test, and that's having a finger prick on a test where a small amount of blood is taken from the finger and tested to see at what level the glucose is. If it's higher than the normal range, then diabetes is diagnosed. In terms of treatment, they can be quite different for type 1 and type 2. For type 1, it's always the administration of the hormone insulin. Traditionally or historically, insulin was taken from animals and injected into humans. Now it's much more modern, and it's produced in a laboratory and injected either using a syringe or a pen device or an external pump, which sits on the waistline and is continually infusing insulin into the body. And all of these methods of control have have pros and cons, and the patient will discuss what their lifestyle is with their healthcare professional, and they will advise which is the best form of insulin administration to take. Type 2 diabetes is treated in one of three ways. The first line of attack is to change the diet and exercise and activity levels of the person with diabetes. So often the person will need to lose weight. So having a healthier diet and increasing activity levels is a really important place to start. Also, oral medication can be really advisable. And there are a few different sorts of oral medications that work differently in the body. Some increase the production of insulin in the pancreas, others reduce the amount of glucose that's released from the liver. And the final way of treating type 2 is just like type 1, the administration of the hormone insulin through insulin injections. And some people progress from being able to manage their diabetes through diet and exercise alone, and then need medication, and then need insulin. Other people may need those insulin injections much sooner. It really depends on what stage the person's diagnosis is at when they first become aware of their diabetes.
Dr. Nash, what should our blood glucose levels be?
Well, the normal range is between 4.5 and 7, and this is because that's what someone without diabetes, that's what their body would naturally regulate the blood glucose levels at. In practical reality, it's often challenging for the patient with diabetes to be able to manage their blood glucose levels so tightly, because it's a bit of an inexact science to administer insulin in that way. But as much as possible, that's the range for us to aim for.
Is diabetes hereditary, or can you be born with it?
Well, certainly there are there's a genetic predisposition for developing both type 1 and type 2. But that means that if you've got a family member with the condition, you are more likely to develop it. However, genetics alone is not enough. There needs to be an environmental trigger. For type 1 diabetes, that's often a virus or some other instigator in the autoimmune system. For type 2, it's lifestyle and obesity and exercise levels and so on. So it's not just genetic. It needs to be an interaction between genes and hereditary factors and environmental factors.
And just to end off, if I've had diabetes for a while and you could become completely fed up with it, there's no days off from diabetes. So what advice do you have for people on how to cope?
Well, yes, diabetes has often been likened to a job, and it's not just any old job. It's a job where you have to work 24 hours a day, 7 days a week, 365 days a year with no days off. And I don't know about you, but I wouldn't stay in a job like that for very long. So there's something about the very real challenges of diabetes where it's inevitable that there will be days where you're just really struggling and want to take a day off. And actually, with my patients, I often advise them to talk to their healthcare professional about exactly that, about giving themselves a day off or a holiday from their diabetes. And that's not to say that they completely neglect their diabetes care, but that in knowing how their diabetes affects their body and their lifestyle, that they can have perhaps one day a week or one day a fortnight in which they give themselves permission to just take their awareness down a notch, so they can, feel that they're doing what they need to stay well, but also that it's not all consuming on that day. And on that day to do something really fun, plan an enjoyable activity, do something, which feels like a real, holiday or vacation from everyday life with diabetes.
Thank you, Dr. Nash. Thank you so much for speaking to me today.
Thanks, Joanne. It's been a pleasure.